What is the most effective pain relief for sciatica? The sciatic nerve is the largest nerve in the human body, and is considered to be a mixed nerve, where it contains both sensory and motor fibers, and it's involved with sensation and movement of the legs, lower back, feet, calves, thighs, those things. It originates in the lower back. It comes out the nerves of the lower back and extends down through the buttocks to the leg and into the foot. So when a patient is actually diagnosed with something called sciatica, they think that sciatica is like one problem. But contrary to what people actually think or popular opinion regarding sciatica, sciatica itself is not really a condition, but it's rather referred to a set of symptoms that can result as a problem or something affecting the sciatic nerve. Sciatica refers to pain, discomfort felt anywhere along the pathway of the sciatic nerve, which is very extensive. Like I said, it's the largest nerve within the body, and it can extend a very vast area. Pain can be pain, it can be numbness, it can be different feelings, but it's caused by the nerve being either pinched, compressed, impinged, or affected in any negative way. So what does sciatic nerve pain feel like? Because sciatica refers to anything that you feel down the sciatic nerve pathway. And to make the answer very quick, it's very case specific. There's no one pain or one problem the person will feel, and this is 100% considered sciatica. It can be pain in the lower back. You can have isolated pain in the low back itself. You can have pain in the buttocks. That's radiating from the low back down into the buttocks. You can have pain in your leg or the back of your thigh. You can have foot pain. And unfortunately, it may not even be pain. It can be numbness. It can be numbness in all those areas in the low back, in the buttocks, the thigh, the leg, or the foot. It could be a tingling sensation, like you're feeling like a little bit of numbness or tingling, like when your foot kind of falls asleep, they mention, and you kind of feel it coming back like a kind of a pins and needles. You can feel electric shock-like pain going down. You can also have weakness. You can have weakness in these areas. Can be a result of sciatica, because if you affect the nerves enough, you can affect the motor control of that area, affecting the muscles. Now, obviously, if it has motor control to the muscles, it may have motor control to other things as well, like organs and other different systems of the body. So it may be also affecting things that maybe you don't necessarily feel, like weakness or pain. Now, the problem is what can compression or what can cause this sciatic nerve pain? Well, the classic thing people look for, and they normally do it with MRIs, is they'll go have an MRI done and they'll look to see if you have a disc that's actually pressing on one of the nerve roots that exit the spine. So we know the nerve roots that come out the lumbar spine kind of branch together to form this nerve called sciatic nerve, and they go down into the leg, and then it distributes down into further different nerves. So all these nerve roots come together, form this sciatic nerve, and then branch back apart. When the disc of the lumbar spine can be inflamed or herniated or bulged or misaligned, it can put pressure on those nerve roots that can actually affect a portion of the sciatic nerve, and it can cause a direct area. Now, they've mapped this out that, if you have like an L1 disc issue or an L4 disc issue, an L5 disc issue, it can affect different areas of your leg. But there is some cross, and not everybody is exactly the same, some cross nerve supply, collateral nerve supply, and not everybody's mapped out exactly the same way. So it's close, but it's not always exact in terms of telling us exactly where the disc issue is, where you possibly could have pain. And not only can it be a disc problem, it can be something called lumbar spinal stenosis. Now, lumbar spinal stenosis typically happens as a result of degeneration of the spine. When the spine goes through a degenerative phase, you start getting bone spurs, and bone spurs will cause something called stenosis, and that's where the holes where the spinal cord goes through or where the nerves exit get smaller than they're supposed to. And if those holes get smaller, they can compress on the nerves, and any misalignment in the lumbar spine now becomes more sensitive to compressing those nerve roots. Lumbar spinal stenosis can also occur not only as a result of degeneration, but also alignment. Because remember, we have these bones that are stacked upon each other, and they're kind of circles stacked upon each other. And if you get two circles and you misalign them relative to each other, the hole they make in between each other becomes smaller than the normal size of the hole. That can lead to spinal stenosis as well. We also know lumbar spondylolisthesis, and this is where a person in the fifth or fourth lumbar tends to be the most common, is where the lumbar spine moves forward relative to the bone below, and any movement in a forward or backwards or a side to side or a twist can also lead to any type of compression. Other things like scoliosis, kyphosis, hyperlordosis, anything like that, any type of misalignment issue can lead to compression of these nerve tissues, which can affect the sciatic. They can affect these spinal nerve roots, which eventually can affect the sciatic nerve. Now, what are some relief options for sciatica? Well, the best long-term option is to find out what's actually causing the scoliosis or causing the sciatic pain and actually reduce what's actually causing it. So if your sciatica is being caused by scoliosis, you would want to reduce the scoliosis to help it. If your sciatica is being caused from a disc problem, you want to reduce what's causing the disc problem to actually improve your sciatica. Unfortunately, many treatment options for sciatica is pain treatment only, meaning they're doing pain injections and pain treatment. And whatever is causing the problem is still there. And even though they're numbing what you're feeling by either numbing the nerve or numbing what you're feeling with medications or injections, what's causing the sciatica is still there, and normally it's worsening because most of the things I mentioned will worsen over time. Sometimes patients are given something like physical therapy exercises to help strengthen the back and strengthen the spine around the area, which sometimes that could be helpful for pain and strength, but it doesn't really restructure the spine back into a better alignment to actually remove the impingement that's actually occurring to the spinal nerve roots, which is causing the sciatic issue. Last thing I want to talk about is something called condition-specific or corrective chiropractic care. Condition-specific or corrective chiropractic care restores its goal or aim is to restore the alignment of the spine to help improve disc health, alignment of the spine, and deal with areas that we call vertebral subluxation. Now, subluxation is a term that chiropractors use to encompass all misalignments of the spine, meaning as the spine misaligns, in any of the things I mentioned previously, it can affect nerve tissue. And once it affects nerve tissue, we call that subluxation. And once you affect the nerve tissue, you can start affecting the sciatic nerve, leading to sciatic symptoms. So this type of chiropractic care that correctively moves the spine back into the right alignment has a great chance of actually improving the effects that sciatica could have to you and to your body and to your symptoms that you're experiencing. So this type of version is something that normally involves not only chiropractic adjusting, but therapy, rehabilitation, and exercises that are structural rehabilitation oriented, meaning they're not here just to make your spine stronger or make your back stronger. They're not only going to do that, but they're going to try to move the spine into a straighter position, so it's more of a structural rehabilitation. If you actually have sciatica and you're feeling sciatic nerve symptoms, the best thing I can definitely recommend is to have a complete evaluation to see what's actually causing it, because the symptom isn't always telling us, like where you feel the problem isn't always telling us where the problem is coming from. Meaning, if you have pain in your calf, doesn't mean you have a calf problem. It could be actually coming from your sciatic nerve, which is coming from your lower back. Here at Scoliosis Reduction Center, we can assess and determine the cause of sciatic conditions. And when we're successful in determining the cause, we're very often successful in being proactive to actually reducing the cause of what's actually leading to the sciatic problems. And more importantly, we can provide long-term reduction in pain, because if you reduce what's causing the issue, you're actually correcting the causation, not just treating the symptom. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.